Indians are fast hurtling towards a heart disease epidemic, with various estimates suggesting that by 2015, the country will be the heart disease capital of the world. There are many factors behind this scary scenario, the primary ones being increasing sedentary lifestyles, poor diet, humongous levels of stress, and unique genes amongst Indians that increase their propensity to be afflicted by the dreaded metabolic syndrome. While healthcare facilities have vastly improved over the years, experts still insist the best way to tackle this epidemic is prevention rather than cure, and cite traditional methods of yoga and meditation as the best bets to beat the disease. Speaking exclusively to ANI, Dr. Mukesh Hariawala, who is an internationally acclaimed Indian-American cardiac surgeon based in Boston and the recipient of India's Most Admired Surgeon 2012 award, said that traditional Indian therapies that cost nothing should be the first port of call for all Indians who could reap enormous benefits by practicing the same.
We are on the tip of a health disaster. We've been reading a lot of reports that, there's obesity, there's diabetes, there's heart problems, and India is probably going to be the biggest killer, diabetes, because of diabetes.
Capital.
And heart. Any tips for a normal Indian? Because these days, I know a lot of people who are having major heart problems at as early as 23.
Yes, absolutely.
And though, a lot of those cases, I do believe that, genes have a role to play. If you're genetically susceptible,
yes.
if your family has a history,
absolutely,
you are more susceptible. Given the fact that India is sitting on the tip of this huge tinderbox, any advice to a city person and a rural folk?
Before I advise, let me identify for the users is that India is going to be the capital of heart disease by 2015 or somewhere around that period. There is a reason for that, is that India is the second populous country in the world. So there is a thing called Syndrome X, which is a combination of coronary artery disease, which is heart disease, diabetes, and high blood pressure.
It's a metabolic syndrome, isn't it?
Metabolic syndrome. It is called Syndrome X. So that is there, very existent in India. But something very diametrically important is happening in India. And what that is that young patients, like you mentioned, are now suddenly being seen in the emergency room, being shifted to the ICU, being taken to the cath lab for angioplasty, and even sometimes surgery. Why is this changing?
Any lifestyle tips?
Yes, I will. And before, this was not happening to younger patients. Has the disease changed in addition to the genomic transmission of, that trait of having heart disease? One very important thing has changed in India. Even when I left India in 1989, is the stress level within the Indian population is rising significantly. People are wanting to be in the fast lane of life and they are trying to be overachievers. Therefore, there is a very high spillage of catecholamines in the circulation, and whenever you hear financial stress or other stresses, you are more likely to fall flat and reach an emergency room. So this was not...
In a nutshell, what are the tips?
The tips, I think, is going to be... Stay cool? More than staying cool, I think it's going to be yoga and meditation. Meditation is what keeps these dangerous chemical levels very low in the body, so you are unlikely to have a catastrophic event.
And how much of a role does diet have to play in this?
Well, diet has to play because that depends on your digestive system of absorption, metabolism and other things. But what you can actually control is transformation of your lifestyle, like going to the gym, and doing exercise and meditation, because meditation and yoga probably is the best. It is not curative, but it is preventive.
So even as we celebrate World Heart Day today, let's pledge to live fully and healthy. After all, it's your own life.